Well, good morning and welcome to the Postpartum Emotional Wellbeing webinar. This morning's presenters are Jamie Charlebois, Regional Perinatal Mood Disorder Coordinator with Community Mental Health Service with Orillia Soldiers Memorial Hospital. And presenting with Jamie is Amber Sperling, social worker and psychotherapist with Georgian nurse practitioner-led clinic. Welcome.
Thank you, Leanne. Hi, I'm Amber, and today we are going to be talking about perinatal mood and anxiety disorders. We're going to start off with a mindful minute to get everybody in a more relaxed learning state. Then we're going to describe what postpartum mood and anxiety disorders are. We will discuss nests, which is one method of reducing distress, as well as different treatments for mood and anxiety disorders. We'll talk about what being a good parent means, as well as communication and relationships, which are very important during this time period. And then we will discuss some resources, including a short talk from EarlyON and CAPC. We'll finish our discussion with some questions. So we're going to get started with a couple polls so we have an idea of who's here today. So our first poll is asking, have you ever felt sad or worried without knowing why since your baby was born? So we'll give a couple minutes here, a couple seconds anyway, to let you respond. Just a couple more people haven't responded, but we do recognize some people have little ones with them and are multitasking. So no pressure to have to respond. So I'm going to end that one. So as you can see, the majority of our participants here today can relate to that question. So our next question is asking, have you had to balance children home off school with a young baby? I'm going to share this. Oh, sorry, I think it might be the same question. I'm going to answer that question up on the screen. Just wait a few more seconds. This helps us to know who our audience is, but also for you to know who else is feeling the same way that you are. So we've got, wait until maybe we have 50% of people responding. Okay. So again, you can see the majority can relate to that question. Hang on one second. Okay, so we have one more poll. If we can put up our last polling question. So I'm not sure if you can see the poll right now, but we'd like to know, do you feel you're grieving the loss of what you expected life would be post-baby because of the pandemic? No visits from family and friends, no access to mommy groups, and feeling stuck at home. So the vision of what you had planned for after your baby was home or at this point in motherhood, is it not quite what you expected? A few more people to respond. Okay. Okay, so I'm going to share those results as well, because as you can see, what you're feeling is common. So we have 78% of people saying yes to that. And sometimes we don't take the time to really think about how we're feeling in regards to our expectations of what life would be like right now. So as you can see, referring to the Postpartum Support International motto, you're not alone, you're not to blame, and with help, you will be well. So let's get started into our presentation. And as I said, we were going to start out with a mindful moment. So we're going to take a moment here, because we often don't question the need to plug our cell phones in at night. Our cell phone's dying, we need to plug it in, we need to have the juice in the morning. We have to stop to get gas on our journey to get the car to keep going. But when we feel depleted, how often do we take the time to recharge ourselves? So we're just going to take a quick moment here with the guidance of Candace Thomas from Evergreen Wellness. And I invite you to just take this short moment for yourself before we dive into some more.
Hi there, my name's Candace, and I'm the owner of the Evergreen Massage Therapy and Wellness Studio right here in downtown Barrie, and the founder of the Live More Project, my social impact project that helps bring awareness to mental health resources right here in Barrie. And today it's my privilege to guide you through your mindful moment right here. So to begin, I want you to take your right hand and place it over your chest, and your left hand over your belly button. These two are going to be your anchors for this mindful moment. I want you to close your eyes, take a deep breath in through your nose, and then let it out with a sigh. One more time, deep breath in through your nose. Feel that hand lift, feel that belly fill, see those hands rise. And then when you exhale, feel them fall nice and slowly. During this, when your mind begins to wander away, I want you to bring yourself back to the sound of that slow exhale, that long sigh. Again, with your eyes closed, inhale through your nose, feel that cool air hit the back of your throat, fill your lungs, and fill your belly, and then slower than you'd like to, let that out. This time when you inhale, I want you to say out loud or say to yourself, I am, and exhale, here. One more time, inhale, I am, exhale, here. Throughout this, I want you to remember every inhale has an intention. That intention is to bring in all that good air, fill your belly, and be mindful of that expansion of your rib cage, that filling of the belly. And then when you exhale, imagine letting go of anything that is weighing on you right now. And tell yourself on that inhale, I am, exhale, here. Thank you for letting me guide you through your mindful moment. I hope you all enjoy the rest of your day. I'm sorry I couldn't be there in person, but I really and truly hope that you enjoyed this quick little meditation mindfulness exercise. Bye, ladies.
Okay, That was fantastic. I'm feeling my shoulders come away from my ears and my jaw is nice and relaxed. It's amazing what 3 minutes of intentional breathing and relaxed breathing can do for your mental health and checking in with yourself. So now we're going to move into some of the content and talk about what perinatal mood and anxiety disorders are. And moving forward, when I say perinatal, what I mean is from the time you conceive to 1 year postpartum. So when we talk about perinatal mood and anxiety disorders, these are mental illnesses that manifest themselves in a variety of diagnoses. So we know that the transition to becoming a parent is highly anticipated, but very challenging. And preconception, pregnancy, and the postpartum period and the transition to parenting make us vulnerable to mental health issues. And that this period of the lifespan brings normal ups and downs with our moods, which we call the baby blues, which upwards to 85% of new moms and dads will experience. But anxiety and depression are not considered normal in this time period. And so it's important to know that perinatal mood and anxiety disorders are very similar to depression and anxiety experienced at different times in our life. But what makes it different is that we have hormonal changes and we have a baby, and that really makes us more susceptible to issues. So many of you may have heard of postpartum depression, or the general population likes to call it, I got the postpartum. Anyway, so postpartum depression is very, very common, and I'll talk a little bit about prevalence in a bit. But we know that 50% of postpartum depression actually starts in the pregnancy and is overlooked or kind of blends in with some of the normal symptomology or discomforts of pregnancy. We're also seeing as a society higher rates of anxiety, especially in the postpartum period, but also with the pandemic and COVID-19 that is going on right now. So we can see generalized anxiety, post-traumatic stress disorder, panic disorder, and obsessive compulsive disorder. We also see bipolar disorder. And interesting that 50% of bipolar disorder is actually diagnosed in the postpartum period. This is a time where a woman will see her healthcare providers more than any other time of her life. And so there are so many opportunities to discuss mental health and treatments and recovery. We also see a peak in eating disorders, and sometimes this can be due to changes with our body image and different aspects of our changing body as we grow in our pregnancy, and then as we settle into the new normal of what our body kind of looks like and will transition in those postpartum days. I also wanted to talk a little bit about postpartum psychosis. This is a very severe form of a perinatal mood and anxiety disorder, but it is also very rare. So we see about 1 to 2 women per 1,000 experiencing delusional thinking and irrational judgment. This type of issue needs to be taken seriously and needs to be taken care of by a specially trained perinatal mental health professional or psychiatry. We know that postpartum psychosis can make it very difficult to take care of a baby. And this is why supports from family and friends and healthcare providers is so very important. So in regards to prevalence, perinatal mood and anxiety disorders occur at rates of about 20%. In our area of North Simcoe, Muskoka, our rates are actually quite a bit higher at almost 24%. And we don't know 100% why that is, but we can speculate that because North Simcoe Muskoka is such a large area of rural and urban population, that we do not have the same access to specialized treatments or healthcare providers. If you live in this area, you know that we can become very isolated due to being in the snow belt and having tremendous amounts of snow, which can keep us in the home. We also do not have the type of transportation access that those in, say, Toronto might have. So we don't have the TTC. Many areas don't have Lyft or Uber. We don't have subways. And honestly, we just got a bus line that goes between Simcoe County and the Muskoka area. So that can really be difficult for new moms and dads in our area. The most important thing to understand is that perinatal moods and anxiety disorders are the #1 medical complication in the childbearing years. And yet there is no medical directive or strategy that dictates how to screen, diagnose, treat, and recover a woman or a man that is going through this type of disorder. So we have medical directives for gestational diabetes. So you may remember having, you know, that nice little orange drink around 24 to 28 weeks pregnant, and then having your urine dipped and all of these things, and that what we call the glucose tolerance test, and having your blood pressure done a lot. So we know that gestational diabetes or gestational hypertension occur at rates of about 6 to 8%. Even combined, perinatal mood and anxiety disorders are occurring at a much higher rate. So we need to really pay attention to this. So you're going to hear us talk a lot about women experiencing these symptoms, but also 10% of our partners or fathers are going to experience challenges with their mood also, which I'll talk about a little bit later. We also see that 1 in 4 or 25% of adoptive parents are struggling with their mood, and 1 in 2 or 50% of our teenage population. And this is a number that makes us feel very uncomfortable. We need to be checking in with our young moms and dads and making sure that they have the support that they need to get through this very challenging time period.
Before I dive into this, I would like to apologize. My computer is making strange noises and I'm not sure why. So I hope that you can hear me over the strange computer noises. So we do want to address the difference between what is perinatal depression versus normal sadness. Because oftentimes with in the postpartum period, we're feeling an abundance of emotions, and then we don't want to add that worry on top of the emotions of, am I normal? Is this common? So we just want to streamline what the differences are, so then you also feel more prepared to speak to your healthcare provider. So the 3 main pieces between depression and normal sadness are severity, timing, and duration. So if you're feeling sad for a couple hours and you're able to move on, or if you're conscious of a cause that led to the sadness, whether it was a loss, illness, disappointment, or a difficult situation, if there's some sort of connection, then it is more likely to be sadness. Now, if this sadness continues over a period lasting more than 2 weeks, and that's not 2 weeks straight, 24 hours a day of feeling sad, but the majority of the time you're feeling sad and you're not sure why, you can't pinpoint that cause, and it's lasting over 2 weeks, then we do want you to consult with a healthcare provider or to look more into whether it might be perinatal depression. There are other symptoms, as we can see on this slide. So being more aware of if your appetite and your sleep are disturbed, more likely depression than normal sadness. If you're able to go about your day-to-day life, maybe there's some tears, but you're able to go about your day-to-day life, then it is possible that it's normal sadness. If you feel relief from crying, you know, I often recommend to clients put on that movie that triggers the tears. Do you feel relief after? Then it's probably normal sadness, and it's normal to cry. But if there's no relief, or you have that common fear that you're never going to stop crying, then we do want to investigate further. Those are the comparison for depression versus sadness. One other thing that you may often be saying to yourself is, this doesn't feel like me. Whereas sadness is something that comes and goes. Whereas with depression, it's, I don't feel like me. So in regards to anxiety compared to healthy worry, again, looking at the intensity, the duration, are you able to go about your day-to-day life? Is the worry taking over? Healthy worry is temporary. It's more likely to be, you know, you're worried about a specific event, and if you're able to problem solve, then the worry diminishes. Perinatal anxiety is accompanied by racing thoughts. You feel like something bad is going to happen. You're constantly worrying. Your mind is filled with these worries. You may find an inability to sit still. Again, the disturbance with your sleep and your appetite. If you're unable to sleep even though you're exhausted, then there's likely something that some sort of treatment intervention could help you with. It's not something that you need to continue suffering from. Those physical symptoms, dizziness, hot flashes, nausea, panic. Panic may wake you in the night if you're experiencing perinatal anxiety. If you have healthy worry, you're less likely to be woken feeling panicky. It is important to remember that your body can't maintain or can't sustain panic. So if you are experiencing some panic currently, it is helpful to know that usually panic will peak at 2 to 3 minutes, and it's not often, I don't want to say never, but it's not often that your body can sustain that state of panic for more than 10 minutes. So just knowing that can sometimes be helpful to reduce the panic. So then you have less anxiety around the panic. And we'll dive a little bit more into that later. And then perinatal anxiety can often be centered around baby. So hypervigilant, you're more overly careful about taking care of baby. And that can lead to obsessive compulsive disorder, as Jamie had mentioned earlier. So just being aware that if you're worried, but your worry is motivating you to do something, and then you feel less worried, it's probably healthy. If not, then we want to dive into that a little bit further.
Okay, so let's look at some of the risk factors for perinatal mood and anxiety disorders. There is a genetic component. So a family or personal history of mental illness will make you more susceptible, or having a pre-existing issues with premenstrual syndrome or premenstrual dysphoric disorder, which is a more severe form of PMS that makes it very difficult to function sometimes a week or two before menstruation. So these show that we have pre-existing hormonal susceptibility or sensitivity. Okay, so there are certain times in a woman's life that she is more susceptible to mental illness. So around menstruation, around the time of childbearing, and again at menopause. Okay, there's also biological factors such as hormonal sensitivity. So we know that around day 4 or 5 postpartum, that's the day we feel really bad normally. Okay, so when we're pregnant, our placenta is responsible for creating those hormones. Once the placenta comes out, we hit kind of the bottom of the curve. We lose all of our hormones, and then they have to slowly build up again. And this is the single largest sudden hormonal change in the shortest amount of time that we will experience as a human being. And so about 3 days postpartum, you're essentially back to your baseline level. So if you can imagine, it's kind of like PMS on steroids. That's the best analogy that I can come up with, because it is so sudden. Our estrogen and our progesterone are going from high to low and then trying to come back up. And so this can make us really susceptible to emotional and psychological issues. Also, there are some medical conditions that can look a lot like depression or make our depression worse. So having low thyroid or diabetes, whether it's type 1, 2, or gestational. I noticed that I wrote it twice here. Sorry about that. If you're anemic or your iron is low, or if you have polycystic ovarian syndrome. There are also some social factors that will make our mental health challenged. So if we don't have a lot of support in our life, we know that positive supports are so important. Family, friends, peers, organizations, and agencies. It's creating that village of support that many of you have heard about. That is so important. And there could be social stresses, like having financial problems, marital problems, or being Black, Indigenous, or a person of color will make you more susceptible to issues. And interpersonal violence.
So on the other side, we're talking about the risk factor from trauma. So when we think about people that have had a type of abuse in their history or experienced trauma, and it's important to say that trauma is in the eye of the beholder. So we're not judging whether or not it is a trauma. That's for the individual. If you have experienced a trauma in your lifetime, you are more susceptible to postpartum mood and anxiety disorders. We also know that in the perinatal newborn stage, infertility is also a risk factor. Infertility creates a vulnerability, idealized expectations, as well as likely previous losses that have not fully been processed by the new mom and dad family. There may be some confusion about how they got there. So they have this child in their arms and it's just a blur, the journey, how they got there. So there are different techniques for people that have experienced infertility. Multiples as well, bringing a whole new bag of things to consider. So 43% of new moms are at risk of postpartum depression if they've had multiples. We know there's added stress with multiples, including, as Jamie mentioned, there's added financial problems. There may be more delivery complications, as well as other stressors that are inherent in having multiple babies at once. Staying in the NICU, we know that there is a very high rate of families that have had a child in the NICU that experience postpartum depression and anxiety. 43% of moms experience moderate to severe anxiety. 33% of moms are reported as having suicidal thoughts. So it is a very stressful period. Again, there's expectations about what life with baby will look like, and that is completely changed with the NICU. Referring to Barrie specifically, which is our area, the NICU space for mom and baby is like the size of some people's dining room tables. So imagine being in that space and having to learn how to breastfeed and bond with your baby. So we know that there's impacts on bonding. So being aware that if you've had a baby in the NICU, then you are more at risk. In terms of pregnancy, birth, breastfeeding complications, all of those things add an extra layer of stressors. And then, of course, baby's health status. So again, those expectations of what things were going to look like, but then all the functional things that come with it as well. So are you having less sleep? Are you worrying more? Of course, that's the obvious one, I think, but worrying about baby. Mom's getting less sleep. Mom's probably eating less because she's more preoccupied with caring for baby. And then also major recent life events. So one of the things that we talk about is trying to avoid moving in the perinatal period, because that is very stressful. Of course, sometimes that can reduce stress, but you have no control over losses. You have no control over job losses, but major life events do as well impact your risk for perinatal mood and anxiety disorders. So, intrusive thoughts. Intrusive thoughts are something that are very common in the perinatal period, but not often talked about. So, scary thoughts are negative, repetitive, unwanted, intrusive thoughts that can hit you at any time. They come out of nowhere. It may be a thought, it may be an image. They may make you feel like you're going crazy, but you're not. Often, we hear they make you feel like you're a bad mother. You may feel guilty or ashamed of your thoughts. But scary thoughts are a symptom of something that's happening. It's not about who you are. I like to look at it as the intrusive thoughts are because we put on sunglasses and the tint has changed. The world hasn't changed. It's just how we're looking at the world. And again, it's a symptom of what is going on. If you're feeling uncomfortable about some intrusive or scary thoughts that you've been having, that's actually a protective factor. I'm not going to give examples of intrusive thoughts today because we also know that by hearing other people's intrusive thoughts, it can trigger new intrusive thoughts. So our intention is not to create more harm, of course, but if you've had some thoughts that you feel uncomfortable about, maybe you feel guilty or ashamed about, I want you to know that if you feel really uncomfortable with these thoughts, you're protecting yourself from acting on those thoughts. And it is reason to reach out to a healthcare provider to get some support in working through these thoughts. There is a process that's quite, I want to say, simple and very helpful. I'm not going to get a lot into it now, maybe later if we have time, but essentially we relabel the thought. So when you have the thought, by saying it's an intrusive thought, it's not me. We're reattributing it to the thought. We're refocusing onto a different behavior. So if you have a scary thought and you refocus to something else, so whether you're, playing a game or putting on a song and singing along, if you distract yourself for 1 minute, it can take away the impact of the scary thought. And then we revalue. What is the weight of this scary thought once we're able to really evaluate what it means and where it's coming from?
Okay, so I wanted to talk a little bit about dads, fathers, partners. So as I said before, 1 in 10 or 10% of dads will experience mental health challenges in the perinatal time period. And what we tend to see is that there's this initial high, and then that can give way to depression. What we also see is that while mom is struggling, partner isn't. And then when mom starts to feel better, then dad or partner starts to experience those symptoms. So maybe there's, the having to keep it together, having to provide that support that is then able to give way to experience those symptoms. We know that depression is 2 times as common in this time period than in the rest of the adult male population. And yet we rarely talk about mental health issues in dads, but we need to. We need to create that conversation. Depression looks a lot different in men than it does in women. So sometimes we see higher rates of anger problems, irritability, aggressiveness, or hostility. So it doesn't look the same as we expect. But it's very important that fathers reach out for the help. And we know that that is very difficult for men to do. But there are organizations and different agencies there to support men in the postpartum time period. And we can discuss that later in question and answer. So I wanted to talk a little bit about treatment. So when we look at perinatal mood and anxiety disorders, we look at what we call a biopsychosocial model. And so what this model does is look at the interconnection between the biology, the psychology, and the social environmental factors that can impact our mental health. So the ones that we're going to focus on today is support, sleep, and medication.
Okay, so NESTS is an acronym that I find incredibly useful working with the perinatal population, working with new families, because it's simple, it's concrete, and these are things we're all familiar with. So you're not really learning a new skill, we're just kind of reframing things so you're able to have something to focus on. So for example, nutrition, something as simple as, have you eaten today? I was thinking after we should have had a poll, how many people watching this with babies have even eaten anything today? So in terms of nutrition, making sure you're getting food in. I'm not even going to get into what you're putting in your body, but starting from, what, when, how much are you eating? Let's start very simple. Exercise. Exercise doesn't mean going to the gym and working out hard. Or maybe that's something you used to do, but gyms aren't as accessible because you have a baby or because of COVID, let's be honest. So exercise might mean let's plan in 5 minutes of going for a walk. Or maybe you have access to go swimming. So let's, how can we work that in? 20 minutes of swimming or something simple. How do you recharge is really the question. How do you get your heart rate up? We're going to get into sleep a bit more in a minute, so I'm not going to talk a lot about that. Just one question I want to put in your mind is, if somebody promised to watch your baby so you could get some sleep, could you sleep? So that's kind of what I want you to think about. Time for self. Time for self means different things to different people. Time for self might mean getting your nails done. Time for self might mean reading that book you've been meaning to read. Time for self might mean you're just sitting outside staring at the sky. There's no judgment, there's no evaluation, but time for self means you feel like yourself. You're able to do something for you. And no, it's not selfish. It's because we need to fill our own buckets before we can fill other people's, including our children and our family, right? So important. So time for self, what are those things that you used to enjoy doing? Can you work that in? Support. Support is so important. We all need peers who get it. We need to avoid those people that we feel there's shame talking to them about it, or they don't get it. We often talk about that mama tribe, talking to other parents with kids around the same age to normalize your concerns, especially right now during the pandemic. Because a lot of this isolation distress is because parents aren't talking to other parents as often to know that what's happening in the home is normal. So we need different types of supports. We need material, practical support. So is there someone that can help with cooking? Is there someone that can help with cleaning? Is there someone that can help watch the kids? So practical. We need emotional support. So we need someone we can talk to about our emotions. And then we need information support. So that would be, you're here today. So you're hitting that box, check. But where do you get your information from? And then comparison support. So that's, that friend that can say, I remember when my kid was that age. I was really frustrated with that too. It ends. So having those people that you can get support from that understand. Okay, so let's talk a little bit more about sleep because it is so important.
Okay, so what's really important to understand is that physiologically, we have some small amount of protection against sleep deprivation. But becoming sleep deprived or having insomnia in the postpartum period is not considered normal, and it can make it very hard to cope. So yes, we all dream about having a baby that just sleeps through the night instantly, but the reality is they are not biologically programmed to do that. And that can mean that we can become sleep deprived. And those that are more anxious or are bipolar are very susceptible to sleep deprivation. So we need to create a plan to help increase or maximize our sleep. So really getting the support that's needed from our partner, our family, our friends, and if you're able and you have the financial ability to do so, you might be able to hire out and get a postpartum doula. My plug is that postpartum doulas can be claimed under many of the flex portions of your benefits if you have them. So look into it, look into your insurance provider, because having somebody that's able to come into the house and provide you that level of support is definitely a treat. And really rallying your family and friends around you to help prioritize your sleep is important. So to maximize a mom's sleep, we want to look at prioritizing sleep. So the general rule of thumb that we all say is sleep when baby sleeps. And this is a fantastic idea. And we have good intentions to do that, but if we're anxious, that can really derail sleep. Because, you know, you might lie down because you're just physically and mentally exhausted, but the wheels are turning and we can't turn off our brains. So really thinking about ways to shut your brain down, to turn it off for a little bit so that you're able to refresh. Looking at sleep hygiene. So look at your sleep environment. Is it nice and dark? Do you maybe need a white noise maker? Do you need, you know, the eye shades or whichever? What is the temperature of your sleep area so that you're able to get comfortable? And then that are safe in the postpartum period and the prenatal period to help maximize your sleep. So please speak with your healthcare provider. For baby, there are lots of different things that we can do to help prioritize sleep. Some of them are what we would consider easy fixes and some of them more challenging. But what we're really looking at for baby is finding ways to maximize mom's sleep. So how can we alternate feeds through the night so mom can get a chunk of time? And when mom is really having an issue with her mental health, we really want to see 6 hours of uninterrupted sleep. Now, I know one of you probably just fell off your chair because how do you get 6 hours of uninterrupted sleep? Support. So if baby goes to sleep at 9 and you have a window until 1 or 2, take that, go to sleep. And some people might say, well, I can't go to sleep at 9. Throw time out the window. Go to sleep when your body signals that it wants to go to sleep. Because when we're sleeping, this is reparative. This is when our body processes things through the day and helps us get ready for the next day. So take as much time as you can. Have somebody come and do a feed. If you're breastfeeding, think about pumping or hand expressing and having or pumping and having that milk in the fridge for family and friends to use through the evening. So there are definitely strategies that exist to support your mental health and your lifestyle to improve sleep. So speak to your healthcare provider or your mental health therapist for some great ideas. And those do not have to come at a cost. So the next thing I wanted to talk about is support. So support is so important, as I've said. So we can look at social interventions for support. Number one, we have to feel comfortable asking for help. And this can be really hard because society tells us that we need to be super moms, that we need to do everything ourselves, and it has to be done perfectly. Well, the answer is no, that's not realistic. We're supposed to have help. If you look at other countries in the world, when you have a baby, the community and family and friends encompass that new family and support them. And the mom isn't expected to cook and clean and do all of those things that we ask them to do. Reach out for help. It's actually a sign of strength that you are prioritizing yourself and the needs of your family. Speak to a social worker or a public health nurse. So in our community, through our public health agencies, we have Healthy Baby, Healthy Child, where a lay home visitor or a nurse comes in and provides you extra support. There's also the EarlyON Child and Family Center, which will actually be speaking a little bit later, along with CAPC. And so you might hear that program as Mother Care or Next Steps or Great Beginnings, and they're going to be speaking to. I know the next two are a little bit more difficult because of our pandemic, but really reaching out and surrounding yourself with other new moms that are going through struggles themselves. There's lots of different types of groups. Everything kind of right now is being offered virtually, or there are some parent educators that are doing small classes outside, physically distant. So get in touch with different agencies in your community. Get in touch with different educators, Facebook groups or whichever, and create that village of support for yourself. And so yes, typically there's lots of great in-person groups at the library or different agencies, but right now the majority of them are online. Also, psychological interventions are very important. We know that the #1 treatment for mild to moderate depression and anxiety is cognitive behavioral therapy or interpersonal therapy. And to be able to access those types of therapy, typically you have to speak to your healthcare provider and get a referral, or you can access that type of therapy through private practitioners. But the #1 most important thing is that reassurance is provided. Lots and lots of reassurance. Positive reassurance is so important. There's also different types of therapy, like group therapy or couples therapy. And we're going to be talking a little bit about communication and relationship techniques a little bit later. Mindfulness is also very effective. So mindfulness, we did that mindful minute at the beginning, checking in intentionally with our breathing, checking in with the different parts of our body, and letting emotions wash over us and released. So meditation is part of that also, yoga, and there is some research saying that bright light therapy is effective, so 10,000 lumens, 30 minutes a day, but this would be called kind of third tier research. But if it works and it improves your mood, that's what's important. Okay, so the other part of treatment is medications. And this is one that we always get a lot of questions about. And it's very important to get evidence-based information about this. So as I said on the previous screen, therapy is the #1 treatment for mild to moderate mood and anxiety disorders. And then when it becomes more moderate to severe, we actually try to start with medications to clear that fog, to increase cognitive processing so we can actually do the therapy. And so many moms say, I'm afraid to take meds. But it's very important to know that there are safe options that do exist during pregnancy and when we are breastfeeding. And so there has to be a conversation with your healthcare provider. So whether that's your family doctor, your obstetrician, or your midwife, about what are the risks and the benefits. The risk and benefits of taking a medication and the risks and benefits of not taking a medication, because small risks do exist on both sides. It's important to know that there is not a one size fits all treatment plan, that each woman that is going through pregnancy and breastfeeding needs individualized consultation with their healthcare provider. So a conversation where information, evidence-based information, is shared and discussed. And there's a fantastic app that's going to be coming out in the next couple of years. Right now, it's being researched by Dr. Simone Vigad at Women's College Hospital. And it's a decision-making app that once you have that conversation with your healthcare provider, you can go home and put the information in, and it discusses and helps guide you through that conversation. So I'm very excited for that app to come out. The next part is the first choice is the one that works. And what I mean by this is that there are, in the perfect world, before we have a baby, a conversation is had with our healthcare provider about our mental health and if we are on medications, what to do next. Then we conceive the baby and that plan is put into place. Well, what we do know is that 60% of babies or conception is unplanned. So we don't always have a plan in place. But if you are on a medication and you get pregnant, speak to your healthcare provider. And as I said, if that one is working ahead of time, then continue taking it as long as it's a safe medication. Most antidepressants are quite safe or very safe while pregnant or breastfeeding. Okay. And Dr. Jack Newman, who many of you will know is like our breastfeeding guru, his office is in Toronto across from Northwark General Hospital. And on his website, if you just type in breastfeeding and medications, a whole page comes up. And he will say that there is very few medications that are contraindicated in breastfeeding. So basically, taking meds shouldn't be a reason to stop breastfeeding. That the importance of breastfeeding usually supersedes that. So when we talk about medications in breastfeeding, we consider medications safe if less than 10% of the maternal dose goes through to the baby. And so Dr. Jack Newman will talk about minuscule amounts of medication going through to baby. And so having that conversation with your healthcare provider is very important. And if you are met with invalidating or insensitive comments from your healthcare provider, seek a second opinion. Mother Risk was an agency that we used to use when we were asking about medications or trying to get solid advice or evidence-based advice, but it no longer exists. So if you go to mothertobaby.org, that is an American website, you can type in the medication and it will pull up all kinds of researched information for you. Please do not go onto the internet and ask this question, because as you know, you can find a spectrum of answers, and we want to make sure that you are getting the best information, the best for you in this current situation.
Okay, so now we're going to move on to more of a talk therapy versus medication. Cognitive behavioral therapy is well researched to show benefit for many different populations, but definitely perinatal mood and anxiety disorders. With CBT, we identify, evaluate, and change dysfunctional patterns of thinking. And when we change dysfunctional patterns of thinking, we change our unhelpful behaviors and our mood, which is usually what triggers us to be working with CBT. I am going to refer to it as CBT instead of cognitive behavioral therapy moving forward. So we're going to do a little bit of an exercise in a second, but I'm just going to go over this a little bit more in depth, and then we're going to talk about what is a good parent. So I want you to kind of have that question in the back of your mind. So essentially, when we have a negative thought, that negative thought will trigger an upset feeling, an unhealthy negative emotion. It's important to recognize that negative emotions are healthy. Being sad is healthy. Being worried is healthy. What is not healthy is when those negative emotions impact our behaviors and our ability to function. So I often work with clients that will say, well, I'd rather be happy. Well, our goal is not to be happy when bad things are happening. It's okay to have negative emotions. So when negative thoughts are causing negative feelings that are causing unhelpful behaviors, that's when we want to pull out our CBT and say, what am I thinking? And how is that changing how I feel and ultimately what I'm doing? So I want to use the example of being a good parent, because often in the perinatal period, when we're overwhelmed with emotion and this huge, let's be honest, huge change to our life, we start to have negative thoughts. And the thought might be, I'm a horrible parent. And then you start to feel depressed. And then you're more likely to bond with baby, or sorry, less likely to bond with baby. Or the negative thought might be, I'm never going to sleep again. So then you're going to be more worried, and you're going to be more likely to avoid going to bed, because what's the point? I'm not going to sleep anyway. So we get stuck in these cycles. So what we want to help you today is to identify those cycles and changing the negative thoughts. And we change the negative thoughts by challenging if there's actually evidence to support that thought being rational or helpful. So let's jump into a little exercise. I hope everyone is up for using their fingers. So at the bottom of the Q&A box, there's an option to click anonymous if you choose not to have your name. But what I'd like you to say is, what is a good parent? So I'm just going to give you a second for a few people to type in what they think a good parent is, because a very common negative thought for new parents is, I'm not a good parent, because of how they're feeling and because of how their life has been thrown upside down. So go ahead. Hopefully we have a couple brave people that are willing to say what they think or what society tells them a good parent is. Just waiting to see if somebody wants to share. It's very possible that we have many people holding babies or unable to type. So I respect that as well. When it comes to being a good parent and thinking that we're not a good parent, one thing that often will happen is that negative thought, I am not a good parent. So then we swing the other way around the cycle by having unhelpful behavior by over-preparing or rehearsing how to become a good parent, which actually can cause more distress. So you're thinking, I'm preparing for the worst case scenario, so that will make me a good parent. But then you're even more distressed. So it doesn't mean you're not a good parent. It just means you're causing extra distress. That anxiety is increasing. So let's see, breastfeeding. That's an excellent example. So, again, society, friends, internally, we're often told being a good parent is breastfeeding. However, so if the negative thought is, I'm a bad parent because I'm not breastfeeding, I'd like to challenge that. So we know that babies are healthy if they're not breastfed. We also know that there are other safe options. We don't push breast is best, fed is best. We know there's different circumstances for different people. So if that negative thought is telling you you're a bad parent because you're not breastfeeding, then let's challenge that and look at the evidence. Is your baby gaining weight? Okay, so let's look at evidence. Baby gaining weight. Is baby thriving? Is baby hitting their milestones? Is there any evidence to say that your baby is not healthy? And if you're able to confidently say, yeah, you know what, my baby is hitting that curve, they're gaining weight, my doctor or healthcare provider is happy, then where's the evidence to say that because your baby is not breastfed, you're a bad parent? I feel confident in saying there's no evidence. So hopefully that helps to reduce your distress around that. Hopefully that's helpful. Is there any other examples before we? Okay, good examples. So attentive, loving, meeting child's needs. So again, if you have that internal voice, sometimes it's that voice that pops up saying you're a bad parent. Well, are you providing attention to your baby? Are you loving your baby? Are you meeting your child's needs? That last piece, actually, whoever wrote that, that's a big one. Are you meeting your child's needs? Is baby fed? Is baby clean? Is baby getting their needs met? Because that is what makes a good parent. And if you're struggling with bonding with your baby, that's not your fault. That's something that you can reach out for help around, because that is common. So to not feel isolated or to be putting yourself down for something that's not your fault. And I think that's really important and ties right in with CBT. Okay. So there's no other suggestions. Those were great. Then I think we'll move on to our next slide. Thank you to those who shared.
Okay, so I wanted to talk to you a little bit about thinking traps. And Amber spoke a little bit about this. So thinking traps are kind of these negative thoughts that we have and we get stuck in. And it's very hard to get out of it. And so when we're upset or we're stressed or we're having challenges with our mood, our thinking can change in unhelpful ways. And they can become distorted or unbalanced. So by recognizing our unhelpful thinking, we can begin to work on changing them. And changing negative thinking is not easy. It takes practice, because for many of you, you've been having these negative thoughts for quite a while. They're not always new in your perinatal time period. And it's common to fall into several different thinking traps, which we'll go over. So as I'm reading these examples, think about what thinking traps you feel. Chances are that being trapped in these thinking traps is keeping you feeling anxious or making it harder for you to make positive changes in your life. So there are 9 thinking traps that are up on the screen. I don't think, let me just see the time. I don't think that I'll go through all of them, but some of them that I wanted to highlight is mental filtering. So number 1, so you only pay attention to the negative parts of a situation and ignore the positive parts. So an example for that is you finally get the baby down. You have a list of things you'd like to get accomplished in that time period, and you're only able to get 75% of it done. Instead of saying to yourself, oh man, I just got 75% of that list done, woohoo! You say, oh man, I didn't get it all done. I suck. I'm not very good at this. And you focus on that negative aspect instead of the celebration of achieving 3 out of 4 tasks. The next one is jumping to conclusions. So you make predictions about what's going to happen with little or no evidence. So, for some of you that experience a panic attack, the symptoms of a panic attack can feel a lot like you're actually having cardiac symptomology or a heart attack. And so you might say to yourself, if you're having a panic attack, oh my goodness, I'm having a heart attack. And actually you're not, it's just the symptoms of that anxiety, but you jump to that kind of worst case scenario. The next one is called black or white thinking, or also called all or nothing thinking. So you see things as either right or wrong, or good or bad. or perfect or terrible. So for example, you know, you call your mom and you ask if she can come over for the afternoon and she says no. So you jump to, well, she's not very supportive. Whereas the reality is, the evidence is she's been quite helpful and she's been able to help you a lot, but she had an appointment this afternoon that she had to go to. The next one, number 8, is shoulding and musting. Okay, that sounds really funny, but anyways, that's when we tell ourselves that we should or we must act or feel a certain way. And this is actually one that we do a lot in the postpartum period. I should be able to do this, and a good mom should be able to do that. So for an example, I should always know what my baby needs and how to soothe her when she cries. And that's kind of put out there that, oh, you know, as a mom, you'll learn what each cry means. Well, I'll tell you right now, I had no idea. And, you know, there was that pressure to figure out what each cry meant. And sometimes crying is just crying. It's the only way a baby knows how to communicate. And once you change them, burp them, feed them, play with them, and they're still crying, maybe they're just upset. Hug them, love them, comfort them, and hopefully it will pass. But that pressure of being able to figure out each reason can be really, really heavy. And so I wanted to tell you that thoughts aren't facts. We can have a lot of things going on in our brain, and our brain can be telling us one thing or another, but it doesn't mean it's real and it's not a fact. So hear the thought, let it wash over you like a wave, and let the wave go back out. Release it. Don't hold on to it. Because it's important to let that negative feeling or that thought pass over you and let it go.
So here is an example of a thought record. If you've been exposed to CBT in the past, you've likely seen this before, but if you've never done CBT, this might look a little bit overwhelming, but I'd like to walk through it with you because it is something fairly straightforward once you've had some feedback or someone going through it with you. It is something you can do at home, and it doesn't have to look this complicated. It can just be very simple. Take a piece of paper. So this situation is something that we felt is probably pretty common lately. So situation. I yelled at my 3-year-old, woke up the baby, who then wouldn't stop crying. That's a situation. Fact. There was yelling, baby woke up, baby cried, right? So situation very straightforward. Emotion or feeling. Sometimes we struggle with this column. Definitely some people have grown up in an environment that didn't support emotion expression or naming emotion. So this is fair if this is difficult. But this is where you can say, I'm not really sure how that would feel. Maybe I want to look at a list of emotions and like, how do I think I'm feeling? And that is okay. So in this situation, we have 90% angry. So again, it's multifaceted. So angry at myself, angry at my kids, angry at my husband. But there's also sadness and guilt and shame. So again, we're human. Humans often do not feel one emotion at a time when there's different situations that are being thrown at them. So if you're not sure how you feel, maybe it's because you feel multiple things. So angry, sad, guilty, ashamed. What is the negative automatic thought? So I often find people confuse the emotion with the thought. So emotions are usually one word and thoughts are a sentence. So in this situation, the parent said, I must be a very bad person not to be happy to have these healthy kids. Certainty, 90%. So very strong. I must be a bad person. So very negative towards themselves. So then we want to look at that negative automatic thought. And as we talked about earlier, let's look at evidence that supports and evidence that does not support. I'm just gonna move my screen around. So evidence that supports the thought. So any decent mother loves her kids. A good person would feel happy about having a new baby. But let's look at the evidence that does not support the thought. I have always cared for my family and friends. So tying that into what Jamie was just saying, are we using black and white thinking? Is it all or nothing? Because you have a moment where you yell at your kid, does that make you a bad parent? Or is it a moment that you yelled at your kid, right? So because there's evidence that supports the thought that any decent mother loves her kids, that does not mean there isn't evidence that does not support the thought that you love your kids. I hope I'm not being confusing. So I usually try to do good for others. There's evidence to support being a good person, if we tie back to the negative automatic thought. And people that know me never think I'm a bad person. So you, in general, have a sense that you're not a bad person, but your automatic thought told you you're a bad person. So just as Jamie said, thoughts are not facts. So rather than sticking in this negative automatic thought that I'm a very bad person, let's change the thought. So it's one thing to acknowledge that the thought's not helpful, but we can't leave it there. We have to change it. We have to replace it with something else, or our brains will just keep coming back to that thought. So the alternative thought, I am an okay person that's overwhelmed and having a bad reaction to motherhood right now. And I'm 75% certain, right? So I think this situation, for those of you that have 3-year-olds or multiple kids, can relate. So you're gonna have moments as a parent where you're not the vision of what parenting should look like, because life is real. And so I am an okay person, I'm overwhelmed. We're not globally rating ourselves based on one moment. So then the anger comes down. Again, we're not getting rid of negative emotions, we're reducing them. So 30% angry, 10% sad, and 10% guilty, ashamed. So we're not sticking with what happened and labeling ourselves and carrying that with us. We're able to say, you know, I wish in that moment I had different tools. I wish I had more energy to deal with the situation differently, but I didn't. And now I'm going to move forward and try to change how I'm feeling by changing how I'm thinking. So that's just one example. I hope it's not too confusing, but there's definitely resources out there to help learn CBT and to be able to incorporate this into your day-to-day life.
That was a great example, Amber. And, you know, what Amber was saying about reaching out and finding, you know, the supports, there are self-help guides to help you through CBT. One of them is Mind Over Mood. And on Amazon, I think it's $28 or $38. And it really helps you understand, you know, what's going on in your head, help you reason and process that. And like I said, changing those thoughts takes work. And that's why it's really important to reach out to somebody like Amber, who's, you know, trained not only in therapy, but also perinatal mental health. And we have lots of people across our region that are able to do that. Okay, radical acceptance is something that I wanted to talk to you about today, especially with the lens of our pandemic. Radical acceptance involves accepting everything about yourself, your current situation, and your life without question, blame, or pushback. Because we all experience uncertainty, and you don't have to like it, but you have to learn to bear with it. And right now with COVID, we're all feeling uncertain. We all have unanswered questions. Many of us, or all of us, are dealing with the decision as to whether we should send our kids to school in September. And any decision you make is okay. And so I wanted to read you a little quote from our perinatal mental health mentor, Karen Kleiman. in the States. So Karen says, motherhood brings chaos, messiness, and disorder, both literally and psychologically. These new obstacles feel uncomfortable since most people tend to do better when prepared or when they know what to expect. Paradoxically, learning to tolerate the uncertainty and accept the unpredictability helps to maintain a sense of control. Being and staying with suffering is not fun or easy, but it can show you that you are able to tolerate more than you think and actually help you feel in control. This is such an important quote because many of us in motherhood feel out of control. We're in a new role. We don't feel like experts in our life anymore. And that lack of control can make us feel very uneasy. But learning to pull different pieces of control back into our life really helps us think and feel within our motherhood role. So taking the time to look at, just what you can control, not all those other aspects in the world that we can't. What is right in front of you? Accepting what's going on in your world right in front of you is so important.
And tying in with that so closely, relationships. So relationships change when you have a baby or babies. There's going to be change. And so accepting, using radical acceptance that things are different can be so beneficial. The focus of this slide is communication, but I actually want to tie in that importance of relationships, that there are very small, simple things that you can do to help your relationship feel a bit more normal, and even just recognizing, speaking to your partner, that, hey, you know what, things are different, can go a long way. I find in my practice that a lot of new parents struggle with communicating. For the person that carried the baby, life changes, it's thrown upside down. For the partner, life changes, but it's not the same. It's different, no matter how we look at it. So sometimes it can be helpful to, have a discussion around an identity pie. So this is kind of like interpersonal therapy, but, if you were to sit with your partner and draw a pie about like, what was your identity pre-baby? And then what is your identity post-baby? What's going on in your life? What do you do? What takes up your time? What takes up your passion? It's not a guarantee, but it's very likely that the partner's pie has changed less than the person that carried the baby. Or more simply, the changes between the pies are not going to be equal. So just recognizing it. It's not to stem an argument, but again, accepting that there's difference. So one way to improve relationships or maintain strong relationships post-baby is to communicate and work on communication. And sometimes it is work. It's one more thing, but you get so much more back by putting a little bit in. So assertiveness is something most people are familiar with. So by using assertive communication instead of passive or aggressive, we're actually building the relationship, not just communicating the information. So we might fall back, you're exhausted, you just don't want to have to put work in. So, being passive. If you could maybe think about, could you be here more, or not saying anything at all when you're feeling overwhelmed, that's passive as well. Or aggressive, like maybe the partner has gone out more than you're comfortable with, and you need to stop spending time with your friends. So it's coming across aggressive because, again, let's be honest, you're probably exhausted and not wanting to put that energy into communicating. But something simple as checking in with being assertive, and Jamie will talk a little bit more about techniques in a second. I'm feeling overwhelmed with keeping up with everything. I need help. So again, you're not being weak, you're being courageous and strong by saying, I need help. And if you could come home straight after work, I would feel less anxious. So just those I statements. I am feeling this way and I need this, not you, which it comes across aggressive, or avoiding the issue like completely, which is passive. So that can be very helpful. Again, it's something small that you can get so much back from. Another small little exercise that you can do with your partner. I work with couples where you set a timer. Start with 30 seconds, where each person has 30 seconds and you can say whatever you want for 30 seconds. And then the partner's going to repeat back what they heard. And you have the opportunity to say, oh, actually what I meant was this. And it's completely judgment-free, but you get that 30 seconds to speak and reflect, and it actually helps with connecting couples. And you each get a turn to do that. And if it's something you enjoy and you're finding benefit from, maybe you extend the time up to 1 minute, 2 minutes, up to 5 minutes in the end, where you get to just speak for that amount of time. A very effective, simple exercise. I'm not going to get a lot into relationships and sex, but that is a real issue in the postpartum period. We know that 30% of women do experience painful sex postpartum, 6 months postpartum. So definitely speak to your healthcare provider about that. Again, it's something that's common. And we are aware that there are issues that come up in relationships around painful sex or not having sex in the relationship. So I don't want that to be an issue that we just ignore. I think it's important to recognize it is something you can speak to your healthcare provider about.
That was excellent. You did the you and the I's, which I don't have to do now because that's so important. So I wanted to talk to you a little bit about Dear Man. And Dear Man is a way to help you get what you want and need when you're communicating with your partner. So many of you, go through periods in your postpartum experience where you want certain things, but you don't know how to ask for it, or you haven't prioritized what you need, and then you feel resentment. And it's important for us to continue communicating with our partners. So Dear Man is an acronym that helps kind of structure and set up communication in a respectful way and helps you maintain a positive relationship. It helps you learn to say no to unwanted requests. And in the postpartum time period, we get a lot of this. We have, family and friends saying and doing things or asking things, but we don't want to be rude. We say, I can't say no. Well, actually you can, and it's your right. So Dear Man helps you structure your response in a more positive way, which increases the likelihood of you getting what you want. It can help resolve conflict, and for you to get your opinion and point of view taken seriously. So I want you to kind of think about something in your head, an issue that you would like resolved. And what I want you to do is think about what specific results or changes you want when you interact with your partner about this. And what do you have to do to get those results? So think about a situation. And Dear Man, as an acronym, I'm going to go through the steps. So D is describe. Use clear and concrete terms. Could we see another movie instead of, I don't want to do that? E, express. Let people know how you feel. I feel this because this. Remember that I feel. Okay, so bringing it back to yourself feels less critical. A, assert. Don't beat around the bush. Get rid of the I don't know, maybe, or we'll see. R, reinforce. So instead of insulting someone, reward them. It will create a happy bond. And M, mindful. Don't forget what you want and what your objective for the conversation was. Don't get sidetracked with past experiences. A, appear confident. Stand tall. Think about your body language. What image are you projecting? And N, negotiate. No one can have everything they want all the time. So be open to changing your ideas or expectations. And you can find, like, if you structure this conversation in your head, or you role play it, or you practice it in the mirror, I know that sounds strange, but it really helps. When you want something, it's important to verbalize that, get it out, speak to your partner, because guess what? They are not mind readers. They do not know what you want and need all the time. So tell them. A lot of the time, our partners will come to us and say, how can I help you? And you're like, I don't know. You know, you have so much on your shoulders, and one more request kind of pushes you over the edge. By using Dear Man and taking the time to speak to your partner or family or friends will increase the likelihood of getting what you want and need. And that's so important, because we need you to be happy and healthy, to take care of yourself and the baby and the family around you. So take the time to think about what you want and need and express that to the people around you.
Okay, so we've talked a lot about what perinatal mood and anxiety disorders are. And we've talked about some techniques that are useful to help with the symptoms around mood and anxiety disorders. But now we want to support you in talking to your healthcare provider. Maybe you're a little more confident now that you know that what you're feeling is not okay. Maybe you've been validated, I hope, that it's common and you're not alone. But some people have probably already tried to talk to their healthcare providers and not felt that they were heard. Or there's, you're already experiencing anxiety. So here's one more person you have to talk to that, spikes your anxiety again. So here's just a few tips we thought would be helpful, again, from Karen Kleiman. So choosing a healthcare provider that you're most comfortable with. So that might be your primary care provider, your family doctor, your nurse practitioner, but it might be your OB, it might be your midwife. And maybe you already have a therapist involved in your care, but finding someone you're most comfortable with. Writing down your symptoms, your questions and your concerns, and bring your list with you. I really want to emphasize this. So before you go in for your appointment, write down the reason you're going in. So this may be 6 pages, but it may be 1 page. Ideally, and I say ideally because I recognize, your head may not feel clear, but maybe that's what you want to write down. I don't know. I just don't feel like myself. But writing down what you want to talk to your healthcare provider about, it may mean that you can go into that office and pass over that list for them to look at, which can also reduce your anxiety. So write down any symptoms. We've shared some today. There's going to be resources sent out to you after. But anything you recognize is contributing to you not feeling like yourself. You're not going to be labeled crazy or a bad mother. Again, this is common. It's not your fault, and there are ways for you to feel better. So yes, that's a common fear, and I hope we can help to alleviate it by letting you know you're not crazy. Your healthcare provider is not going to think you're crazy. Also, asking your healthcare provider to check your physiological functioning. There is a lot of interaction in terms of your thyroid and different components of your blood count that are outside my scope of practice, but I encourage you to ask for blood work to determine if there's something else that's contributing to how you're feeling. And maybe that's a conversation starter, that you don't feel like yourself, you'd like some of the physical stuff checked out, and here's some other symptoms because I'm not feeling okay up here as well. If you're breastfeeding, Jamie talked about this quite well, so keeping in mind many medications are very safe to be used in while breastfeeding. If your healthcare provider says a hard no, that they don't believe medications are safe with breastfeeding, that's a really good sign that you should find someone else to talk to. I'm going to put it bluntly, but your healthcare provider may not be up to date with current research. And maybe that you can pull up that website to show them, you know, actually, here's some information, or would you mind calling Jack Newman's clinic? But being aware that if your healthcare provider shuts you down on taking medication while breastfeeding, they don't have the information that is most up to date. Another thing that you can do to take into that appointment is filling out the EDPS online. So you're filling out the assessment, which assesses essentially whether or not you have a perinatal mood or anxiety disorder, which is what most healthcare providers should be doing in office at recommended intervals, but we know they aren't all doing it. But if you were to fill it out online or print it off online and bring it in, then they have that evidence as well. You can ask for a referral to a therapist who has special training in perinatal depression and anxiety. If you are part of the family health team, a nurse practitioner-led clinic, or a community health center, you do have access to therapists that are covered as part of being rostered to one of those clinics. So it should not be at an extra cost. That being said, maybe you have benefits or you recognize the benefit of paying out of pocket to see a therapist. There are options, absolutely. I also strongly recommend that if you are asking for a referral, to ensure that on that referral, it is noted that you are experiencing postpartum mood or anxiety struggles. Any sort of postpartum mental health should be flagged, because most mental health therapists will fast track you through intake, because this is something we need to take care of as soon as possible. You deserve to have help now. You can also, I'm going to jump to the bottom there, that if it's helpful, ask a partner or a friend to accompany you for extra support. This can be helpful to help you communicate, but also a second set of ears to help gather information and clarify things later. This is something Jamie and I were talking about, that it's difficult. It's very difficult. We recognize that you're already struggling and now you're being asked to do something advocating for yourself when you're not feeling the strength. And it's like that cycle. You're not feeling strong enough to ask for help, and then you don't get help, and then you don't feel strong enough. But unfortunately, we're living in an environment right now where you need to advocate for yourself. So no, it's not ideal. No, we don't think it's okay. However, you have the right to expect your provider to be informed and supportive. You also have the right to be an active participant in your healthcare and your treatment plan. And you have the right to say, this is what I need. And if you don't like the response, you have the right to go elsewhere. So yes, there may be frustration around the fact that you have to advocate for yourself, but advocating for yourself will help you to get the help you need that much faster.
Very true. And sometimes, you know, if you need help advocating, bring your mom or your partner to your appointment with you, because it is hard when we have this mental fog or this depression or anxiety sitting heavy. It's hard for us to get our words out. So maybe you make the list, maybe you have somebody that comes with you to help fill in the blanks as you're telling your healthcare provider.
I just wanted to add something quickly, Jamie, that often comes up when I'm working with clients, especially in the groups. There is a stigma that remains around CAS, Children's Aid, Family Connections, that if you express that you're struggling as a new parent, that they will call CAS. This is a myth. This is absolutely not true. So I don't know how I can emphasize it enough. That is not something you need to be afraid of, including if you go to emerge. If you're feeling this is a mental health emergency, you need to seek help immediately. Seeking help does not mean that they will be opening a file on you and your family. I think that's really important.
Absolutely. Okay, so one of the different treatments that we've created in our region is called the After Baby Group. So this is a group specifically for new moms and dads that are experiencing struggles with their mood after baby. And this group was originally created in Collingwood at the Georgian Bay Family Health Team. And we've pulled the model throughout our entire region. We actually, before COVID, had 11 groups running in our area. And these are typically face-to-face groups, closed registration, facilitated by mental health therapists or people specially trained in perinatal mental health. So all of the groups except for the one in Barrie are closed registration, meaning that people have to call and register for the group. In Barrie, because it's such a large area, this is Amber's group actually, we have an open group that runs the same day and time, and anybody can come because we didn't want there to be any limitations. And so you can see that the groups are run in many locations. And what we do is we use cognitive behavioral therapy principles. So participants gain an understanding of expectations versus reality, about how to manage their stress, how to take care of themselves, challenging those unhelpful thoughts and thinking. So some of this content we've talked about today. How to communicate with your partner, what relationships are like after having a baby. We talk about infant attachment, and we talk about self-compassion. All of these things are very important, and these groups are typically, 6 to 8 weeks. And unlike other groups, this is a group where people feel comfortable to talk about their mental health issues. There are lots of other mom groups, but many people might hold back because they're looking around at the other women in the group. They don't, it doesn't resonate with them. They don't feel comfortable divulging what they're going through. But the After Baby group, everybody is saying a very similar story. People are having similar struggles, and that type of support, you can't replicate that somewhere else. And so we're really excited this fall to be offering more groups. They will be online over various different platforms, whether it's Microsoft Teams or Zoom or Ontario Telemedicine Network. So if you are struggling and you want to join a group, please reach out to me. If you can't reach out to me, please reach out to your EarlyON or CAPC facilitators. They all know how to get in contact, and I am the point person for this program.
So before we wrap up and have time for some questions, I know there's one waiting to be answered already. We really wanted to share Postpartum Support International, which is an amazing resource, their motto. So you are not alone. Other moms experience this too. Connection and support will help you. You are not to blame. This is not something you caused, and this is not a reflection of your ability as a mom. And with help, you will be well.
So now we have two facilitators that are going to speak about their programming. So we have Judy from the EarlyON Center in Barrie, and we have Colleen from the CAPC program in Midland.
Thank you, Jamie. I'm Leanne Ross, in for Judy Benton, who is experiencing technology issues today.
Here, I'm here.
Oh, you're here. Sorry.
I made it.
I'd like to introduce you to Judy Benton, who is with Empower Simcoe's EarlyON Child and Family program as a program facilitator. Welcome, Judy.
Thank you. Yes, this is the fun thing about virtual things, right? We don't always get in and don't always get on. If you haven't yet heard about EarlyON Child and Family Centers, or ONIVA as it's called in French, these are centers that are located throughout communities all over Ontario, and they're here for you. So they're a support for you, they're a resource for you. You can drop in at any time during our hours that we're open. You can come and play with your baby or your young child. And we're free of charge for all families and for babies right through to 6 years age. So it's a great place to come and play, gather resources, ask questions. All of the program facilitators, like myself, have a background in child development and infant mental health. And we're happy to answer any questions that you might have about how your child's developing. EarlyON is created to support learning, development, health, and well-being for your child and for yourself. And it's that sense of community that we want you to know about that is in your community. You can access us, you can ask questions. Now, of course, during COVID times, we are not open at present time for play, but if you use your search engine and punch in EarlyON or EarlyON Child and Family Centers or ONIVA, you're going to discover that our virtual programming is still happening. So we're doing programs like Baby and Me programs, where we have a variety of speakers, including Jamie, to talk with you about different components of your well-being and your child's well-being. As well, we have programs right through for children up to age 6, and we offer Indigenous support and early literacy support. So please check us out, and at any time you have any questions, don't hesitate to call. You'll find our phone numbers on our website as well, and we're happy to help you in any way we can. Thank you.
Thank you, Judy. I'd now like to introduce you to Colleen Hood, who is the site coordinator for North Simcoe County CAPC and CPNP programs with Catalpa Community Support Services. Welcome, Colleen.
Thank you. I'm happy to be here to share a little bit of our information around the CAPC and the mother care programs that we provide across Simcoe County, and to give you some information on how to connect with us as well, which is on the screen at the moment. So I want to let you know that, well, pre-COVID, we did community programs, as most people did. But right now we're doing virtual programs across our county locations. So the county locations that we do run programs are Midlandton area, Collingwood, Barrie, Bradford, and Orillia. So if you live close to those areas, we're each running a virtual program once a week. You can find out the information on our Facebook page as to what day that's running, or you can call one of the local numbers at on the screen here, and you can find out more information from someone. They'll give you a shout back. Okay, so during our virtual programs, it's a nice way to chat and connect with other parents. You're getting some support from parenting, some validation on, I'm not the only one feeling this way. And also we have our facilitators on there as well, so we can help to refer, if there's something specific that comes up, we can help to refer you to the correct place to get additional support for that. We do have our new virtual program coming up, which is our mother care specific program. So that'll be starting in September. So that's for prenatal through to 8 weeks postnatal. And it will have topics and resources that are very specific to that time in your life, with the prenatal time and new postnatal. We have in the past had our public health unit nurses involved in those programs as well. At this point, I'm not positive, but I'm thinking that they'll be able to come back in for some of the virtual programs. If not, like we say, we're really happy to connect you with who needs to be the right support for you. We've had some gardening programs that we've run this year, which have been really therapeutic, as we hear from parents that it's been a great way for them to A, grow their own food, so food access, B, just get themselves involved in something that they're happy doing something, and their children could help them if they're old enough. And so some of them have been involved in what we call a kaha box, which is a box that they keep on their own, property and do it from home. Or we have our community gardens, which some parents have come out. We schedule them one family at a time, so we have some face-to-face with the proper health and safety, social distancing happening. And so we can not only talk about gardening, but we have that actual face-to-face for some people that are really feeling isolated. So give us a shout if you're interested in being involved in that too. So we do have newcomers to Canada programs that we have running. We have supports for young parents that are returning to school, or trying to find some information on parenting and getting supports for whatever it may be, goals in life, that type of thing for themselves. So as you can see online, that we are on the page here, we are funded to support low-income families living in Simcoe County. Your child must be under the age of 7. For the mother care program, as I say, you are going to be prenatal through to 8 weeks postnatal. For participating in some of our programs like the virtual or the gardening, or we have another program called a family support program where you can call and chat with any one of our staff. So it's called Families Visitor Program, pardon me. If you take part in one of those each week, we have grocery support. So you will receive a $20 grocery card electronically. Will come to your email, and you can use that in any of the stores that are local to you that sell President's Choice products at this point. So that's to help support you in getting healthy, nutritious foods, milk, that type of thing for family. So please take part if you're interested in that as well. We do have some new groups coming in September, specific to children's program activities. We used to do something called Make and Take, or Food in the Kitchen. We're going to try that virtually, so that should be fun. And that helps with some cooking and food skills and nutrition. So that's us in a nutshell. Please give any one of us a call at the phone numbers below. Please look on our Facebook page and follow any of our programming there. So it's www.facebook.com Simcoe County Cap C, and that's our Facebook. Thanks, everyone.
So thank you so much for everybody that registered today and were able to attend our webinar. And I want to say a special thank you to all of our community partners and agencies, and to our IT support, Christine Vanderbilt from EarlyON, Simcoe North, because this was pretty flawless. I'm pretty excited. And so I want you all to know that you will receive a follow-up email with a resource guide and contact information. If you are struggling with your mood, don't do it alone. Please reach out for help, and we will help you find the supports that you need within the region. Please take care and have a great day.